If you're a mom who needs just one night that's all about you, I need you at Mom It Ain't Easy, the Mommy Collective Summit on October 1st at the Mayfield in Chicago. We're talking incredible food and drinks, local vendors, live music, amazing raffles, inspiring conversations, and our signature panel featuring moms who are building careers, businesses, and lives they love. Plus, I'm excited to announce that Anna Bellaval will be joining us as our surprise guest for a live conversation and audience Q&A. Trust me, you don't want to miss this one. Grab your tickets now at themommycollective.com. I'll see you there.
Welcome to the Mommy Collective. I'm Paulina Rowe, radio host, TV contributor, writer, and mom of one. This is where ambitious moms come to keep their identity intact while navigating motherhood. Here we talk about the real stuff: career, money, relationships, identity, and everything that gets messy in between. You won't find sugarcoating or cliches. What you will find are unfiltered conversations, real resources, and proof that you don't have to lose yourself to be a good mom. The Mommy Collective is here to remind you can be ambitious, you can take up space, and you can thrive in motherhood and in everything else that makes you, you. Before we get into the episode, make sure you're following the Mommy Collective on Facebook, TikTok, and Instagram, and share this podcast with a mommy in your life who needs a little inspiration or just a reminder that she's killing it. Also, don't forget to sign up for our newsletter and leave us a review so we can keep showing up and reach every ambitious mom out there doing big things. Let's get into it. Hello, it's the Mommy Collective, another episode, and I am so excited for my guest today. I got to meet her in person. I got to, really witness her story live, and I felt like I had to call her, bring her on the pod. I'm like, we got to make this happen. So I am so excited to introduce today Dr. Roohi Jeelani. How are you today?
I'm good, and thank you so much for having me. When I heard about your podcast, when you were describing it, I was like, I have to be on. This is everything I stand for. So thank you for thinking of me. I'm honored to be here.
Of course. Well, thank you for coming on. I know you are extremely busy. So I was just so happy and grateful that you were down to come and talk to the moms listening. One thing I've noticed since becoming a mom 2 years ago, right? I'm like, this community is just so cool for so many reasons, right? The mom community. I feel like we, at the end of the day, no matter what kind of mom you are, this or that, I'm like, we all come together at the end of the day and just go like, hey, this is hard. So let's connect, right? Let's build community around motherhood. Every mom's story is so different, right? And just so unique. And when I heard your story, I was like, we have to talk about this on the pod because you are so open about it too, which I hope really does help a lot of women and moms, feel heard, seen, connected. So before we dive into that, I would love for you to tell us a little bit about yourself. I know you're a mom of 3 and you are a fertility specialist, essentially. Yeah. I love it. And not only that, but you also are very open about your own story. So I just think it's incredible. And your journey is very inspiring. So go ahead and take it away.
Thank you. So I'm a fertility doctor by training, and I was lucky enough to know that I would need fertility help very early on. Unfortunately, my parents had a really rough divorce and my mom was abused. So we actually ran away at night and drove to Chicago. And when we got here, I was 11 and I hadn't gotten my period and every year they'd be like, okay, but all my cousins were. And keep in mind, my mom went from being a housewife to then working at McDonald's and Taco Bell and Subway, and we were living from different houses. So just a really rough time period. So then she started worrying that, oh my God, did she cause something or something wrong with me? Because when we would go to the doctor, they would constantly say I'm anorexic or have an eating disorder, and that's likely why this happens. And I'm just genetically very lean always, my whole life. So finally my mom was so frustrated. I was 14. And so she asked her brother, who was a doctor, she's one of 10. And her oldest brother said, why don't you take her to a reproductive endocrinologist and see what, if she's anorexic, that's, you could tell from your hormones. So she decided to take me to a reproductive endocrinologist, AKA a fertility doctor. And I remember sitting in this waiting room, which I actually live and worked at as an adult. So it's super cool. But I remember sitting there as this little girl in this waiting room. And there was a lot going on. I don't know if anyone's ever been in a waiting room of fertility clinic, especially when nothing's virtual, everything's in person. There's a lot of emotion there. anxiety, the fear, the happiness, that it's very high strung. And I remember being called back, and my mom came with me, just like any mom would to a 14-year-old. And this was the first time ever they told her to step out. They said, no, actually, we're going to see her alone. You need to step out. So I sat in this room waiting for my doctor, and this room was filled with reproductive organs. And I'm brown, and we don't talk about this kind of stuff in our family at all. So it literally was like a penis and a breast and a baby being born out of the canal. And I was like, whoa, like, where am I? And I remember when my doctor walked in, and the first question, even before she started speaking, because I wanted to know what was I going to get into, like, what's going on here? And I said, what do you do? Like, what kind of doctor are you? And she said, oh, and she was so sweet. She goes, oh, honey, I make babies. And I was like, you make babies, not God? And she goes, I put two cells together and it becomes a baby. And I was like, oh my God, I want to be you. I want to help build families and create life and, be a part of that journey. So everything she said beyond that was kind of like way past me. The only message I remember her saying was, I'm going to need fertility help, and she makes babies. So from that point on, it became my mission that I'm going to help build families and be a fertility doctor. In that, like, I knew I would need fertility help, and I just didn't, I guess, fathom how much help I would need because I was so laser focused on advancing my career, being, this fertility doctor, that I kind of pigeonholed that, okay, I'm going to need help, but it seems like it's okay. Like, she didn't make a big deal out of it until I actually got to trying to build my family. And it was very difficult. It came with a lot of like poor quality, a lot of frustrations, a lot of not being able to find the right clinic and being told, like, get a donor, get a surrogate, we can't help you. And even though I was a doctor, I felt really dismissed because people don't practice that way. People, just say, well, you have a lot of eggs, but they're bad and sorry. And then so I independently as a patient started looking at, well, what can I do better and what can I do different and what's changing? Like, why do I have this? Like, what is it in my family that gave me this? So I started practicing really proactively, and I finally had my son, and I thought, okay, well, this field needs to advance. It's a very young field and we're missing a lot of it. And I thought I could do this through research. And I became a Warher Scholar, the MD PhD track. And
Yeah.
yeah, but
Congrats.
it
That's
was,
awesome.
thank you. But it wasn't it, because as we know, with the current political climate and everything
Right.
going on, that it's hard to do research on women, that there's not a lot of studies, they're science backed. A lot of this is driven by curiosity and us saying, like, even like endometriosis, right? Like, up until this year, it was, oh, you have to have surgery to get diagnosed. And the average time from onset of pain to diagnosis is 7 years. Like, can you believe, like, women suffer in this unknown mind space of pain with sex, quality of life for 7 years before actually getting a diagnosis? So just women's health has been ignored for far too long. A lot of the clinical trials are done on our counterparts, which is okay. And there's a need and a time, but stuff like this, it's very limited. So I couldn't really advance my research to taking it to the human level. So I left and went into private practice to say, okay, well, maybe I can practice and I can help educate my patients, and so they don't have to feel what I felt. And through that started doing research, became a research director. Through that, then grew my practice, and a lot of patients, these typical cases started seeking me out, and we started kind of incorporating an integrated approach into holistic care and like mind, body wellness and healing, and being more proactive than reactive, dabbling into kind of like things that are not proven, but proven in other fields. Let's extrapolate the data. And through that, everyone's like, well, you need to find your own company, because you can't, like, this has to be something, a bigger platform, because there's a big need for it. And that's how last year I left and founded my kind of own company, but through my own struggles. Like, it's really stemmed from just being really hopeless and being in the darkest of days, because it's such an innate need to want to be a mom, right? Like, we grow up, and my 3-year-old says it, like, when I grow up, I'm going to be a mommy. But even though we don't say it, we know that, hey, when I go build my family, like, we just think it's going to happen. And it doesn't for everyone.
No. And I learned that as well. Kind of going into the motherhood journey, right? Like even miscarriages, I think, for example, are talked about more now, but I just don't really remember that back in the day. I don't know, like maybe pre-social media. I don't know. I just don't remember. Like I guess my mom had one, and I mean, I understand like it's my mom, she's older than I am, but like I didn't even know until I told her I had one. You know what I mean?
Yeah.
And it's like just really not spoken about. But now I do feel like even, you have a very huge social following. And I feel like even you educate and talk about these topics and make it just so much more normalized. And I think that's so important.
Yeah.
And you're right. You're absolutely right. So a lot of advice that we're told, right, when let's say we're going through fertility issues or we're struggling with fertility, what do you feel is maybe, I don't know if I even want to use the word like, out of out of date, right? Like outdated information. But do you feel like everyone's journey is different, or do you feel like we should all still start at the same place, right? And by that, I mean, let's say me, for example, which this is a true story. Like I wasn't getting pregnant for a year. And that was sort of what my doctor recommended that we do, was try for a year, naturally, like change your diet, right? Certain things, right? But like we didn't do anything, like we just literally like, do the deed and eat right and exercise, things like that, right? Lifestyle changes. But then I think about, for example, women who might be slightly older, right? Like, do they have a year to do that and experiment? And like, I feel like it's such a time game as well. And it can be, right? And I know people get frustrated because things aren't happening quick enough. But what's your take on that? Like, where would you guide a woman, right, who comes to see you? Like, is it kind of different for everybody, or do you still sort of start at the same baseline? Like, let's start here.
I love that you asked me this, because if there's one thing I could change is exactly that. The whole premise is people, including me, right? Like you would think I'm crazy. You'd be like, Roohi, you knew at 14 you had PCOS, but why were you afraid to see the doctor? And it wasn't because of the type of help. Like it took me so long, Paulina, to see a fertility specialist because of that, like that idea or notion that, hey, you have to fail before you come see a fertility doctor. And guess what you get with failure is human nature: frustration, anger, right? Sadness. And that's when you go to a fertility doctor. So the heightened sense of emotion that patients feel a fertility doctor sees is equivalent to that of someone who's being diagnosed with cancer, a life-threatening disease. That's who we're currently seeing now, and that's what the data shows. But I would love to change that, right? Like the whole premise behind Onto Health is your ovaries are an insight into your aging. They're the most sensitive. So they're a biomarker. Your reproductive hormones are a biomarker of your wellness. So if that function is not existing or something's wrong, then you should address that sooner instead of failing before recognizing the root cause. So we this week acquired a company that's a diagnostic tool that can get to the patient sooner. So they don't have this notion of, I have to fail and then I'm going to get my testing. And then I'm going to get my testing. Then I'm going to go back and think I can fix it. And then I'm going to fail again and I'm going to go see the doctor. So do you know that I'm really big into health equity? And the average time, especially somebody of an ethnic background, any ethnic background, the time that the onset of when they start trying to actually seeking out help is 2 to 3 years. That's insane. And like, just like you said, like I was lucky that I was in my 20s. So by the time I had my son, I was in my early 30s, but not everyone's that lucky because not everyone finds that partner that early, or not everyone starts trying. Like if you start trying in your mid 30s and you were not seeking care until 2 to 3 years later, you're close to 40, which like take home baby rate drastically drops.
Yeah. Oh, 100%. Yeah. That's why I was always so curious. I'm like, are we still following that advice? But like, I do like that we kind of, well, at least like you said, like we should be looking into other parts of it. Right. And I honestly love that you found out at a young age, because I mean, correct me if I'm wrong, I almost feel like too that helped you like mentally, like you said, kind of prepare of like when that day comes, when I have my partner or whatever, if you're doing it by yourself, whatever, you got some tools under your belt,
Yeah.
And I do love that you, as unfortunate obviously as it is, I do love that you were able to like find that out at a young age and like, take your steps. But like, I'm curious too, right? Because there's like a big difference between understanding infertility as a doctor, right? And then obviously experiencing it on your own body. So I'm wondering, like, what did becoming the patient teach you that medical training could never or couldn't?
Oh my God, so much. It's such a loaded question because
Right?
I can talk on and on about this. What being a patient really taught me is, this sounds horrible, but our system's broken. Our healthcare system's completely broken. That number one, you already highlighted this, but you have to fail before you see a fertility doctor. That you can't get your testing done or covered until you fail. So I have to code and write, even though 90% of states cover diagnostic testing, I have to say that you have infertility or have tried for a year and are not successful to even get that testing covered. A lot of this is not currently covered by insurance, so it becomes a big financial burden on the patient. So that makes it harder for patients to enter that landscape or even consider it, because as soon as they think fertility, they think IVF, and then they think money, and then they think the financial burden. But if it didn't have that connotation, and then we could intervene earlier or test sooner, then they wouldn't need such intrusive or invasive testing, or the treatment. That if what I needed to successfully get pregnant, even conceive, after my failed cycles, my daughter spontaneously, had I not met my partner earlier, in my 40s, I needed way more intervention and medical treatment to have my baby that I have now. Just because age dictates fertility. So that's broken, right? The whole notion of fertility is broken. And then the infrastructure, the operating system. So many instances, I switched to every clinic. I didn't live in this state. I lived in another state because there's long timelines to see a fertility doctor because it's a subspecialist. So we're rate limited by the number of doctors available. It can take months on months to see the doctor. Number two, once you do your diagnostic testing, then you have to wait again to start treatment to meet with the doctor or provider. Everything's kind of constrained by this doctor's availability or timeline. So being a patient, when I had my first IVF cycle, I had nothing make it. I had to wait a couple months to see the doctor to figure out my next steps. When I had a negative pregnancy test, I had to wait for my period, call the clinic, only to be told the doctor's not available. You have to meet with them before I give you next steps. Right? It's 2 to 3 months, but those 2 to 3 months cumulatively add up. It took me 5 years to have my son, which is insane and frustrating. And once again, I had the luxury of time because I started intervention sooner, but not everyone does. So in my current practice, what I've done is I've picked the patient pain points. At what point was I so frustrated? I said, give me my records. I need to leave. Even though I knew mentally I'm starting the same thing over again, I felt better, right? As a mom, as a patient, you understand that. It's so upsetting to be told, well, you have to wait for somebody to decide next steps when you yourself know the next steps. I'm my period's coming, I'm going to ovulate again. What do I do now? So I fixed that infrastructure with my operating model. So I'm very operationally driven. What does that patient journey look like? So what's that roadmap? When do you need intervention? So all of my patients have appointment type set up. They have constant check-ins. I needed a partner. I hated when someone said, you have to do this. And it may be the type A in me. I don't know how you are, but when someone says you have to do this, I'm like, but why? But that annoying toddler, but why? But why? Yeah. Tell me why. I'm not going to fight you, but tell me why. You'll get my buy-in. So I try to educate my patients a lot more than just randomly say you have to do this.
100%. And fertility treatment as well, can really, I'd say, make us kind of feel a lot of different emotions, right? And you mentioned it is hard. So sometimes I feel at one point you probably feel your body is just at this point becoming just a project, right? Appointments, medications, numbers, I'm talking the constant monitoring. So how did you protect your sense of self while going through this?
I took a lot of breaks. I always tell my patients mental breaks are so important. I did not do that in my first journey. I just thought any day wasted, especially because I was waiting on someone else's time and an appointment for next steps. I mean, my son's 12 now. So this was way back when there was really no mid-level providers, everything, nothing was electronic. There was no social media. You truly were just stuck in this dark hole, I felt like. And I didn't protect my peace. I didn't seek out help or therapy. I was constantly in this, I didn't share my journey. I was head down, laser focused. I have to do this. If I can't do this successfully, I'm a failure. So my postpartum was really difficult. It finally, like when I delivered, it was traumatic. I had an infection. He was in the NICU. I was on this maternal special care. Like I was sick. So it was disastrous, but it also felt like complete detachment because I was on this high and of this like guarded feeling that I didn't know how to feel that happiness from like actually getting to what I longed for, as opposed to my last journey. This one also took just as long, but I protected my peace. I shared my journey. Like, as I'm glad to hear that it helps others, but it also really helped me. It was like, like a diary. Like, this is what happened today, or like, this is my miscarriage and this is unfortunate and I'm bleeding, but like, help me share my feelings. I also really did breaks. Like, I always tell my patients, like, breaks are okay. I took breaks.
Yeah, no, that's great advice. I 100% agree. And what, as far as, your own personal journey, what do you feel like from the day like that you were like, okay, I'm going to try to conceive, right, my son, like your first pregnancy? What kind of steps do you feel like you took that kind of like helped you prepare? Like, do we still do the like, make sure we're eating healthy? I know obviously like, you knew, and again, like that was wonderful that you were able to know that ahead of time, like kind of where you stood with that. But like, were you like, we're going to eat healthy, we're going to exercise, or were you more, because I know you mentioned the holistic approach, or did that kind of come later?
It definitely came later. Unfortunately, it came out of my own journey because it was like, oh, you have
Mm.
PCOS, but you're skinny. Actually, doctors told me I'm too skinny. Once again, same thing. You're too skinny, wrong diagnosis. You don't have PCOS. So like no one really said, well, let's look at your metabolic health. Let's look at your cholesterol. Let's look at your blood sugar. Let's look at your vitamin D level. Like I had so many miscarriages, and like come to find out later, like I started doing a study. I'm like, there must be something I'm missing. So I checked my own D. Then I started supplementing it. Then I started looking at like knockout mice model. There's a doctor I started following. Her name was Dr. Neil Perry. She's African American, but she said when you have melanated skin, you don't process vitamin D, and vitamin D receptors are in your uterus. And when you're lacking that, you can miscarry. And like, I was like mind boggled. Like no one was sharing this with me. And when I would ask my doctors, they'd be like, oh, they're animal studies. I'm like, well, there must be something to this, right? Like I get there's not. And that's where I guess my frustration comes from. Like I get these are animal studies and I get we're limited in doing women's studies, but this is an observation. Like, do you see women who are brown or but PCOS have low vitamin D? Do you see that they have a higher miscarriage rate? Oh, let's see. Like it's not, I'm not saying, oh, let's go sell vitamin D supplements or scream at the rooftop, but let's just see, let's restore it. Let's see. Like that's what I needed. That's the kind of approach I needed. So this holistic approach came from my own journey to see, let's see and let's learn. Everyone's body's different. I don't know how you were, but I was like, oh, we're going to try and we're going to get treatment.
Mhm.
Everything was reactive. Like I remember I used to drink soda all the time, breakfast, lunch, and dinner. And then I realized, I was like, oh, wow, that's a lot of caffeine. What does that mean? Like I was really reactive.
Yeah. Oh, no, 100%. I'm trying to think. Yeah. I mean, for me, like personally, so we tried well, I had the miscarriage, right? And then nothing was happening for a year. And I'm like, oh my God, like, what do I do? And then I started getting like information slowly but surely, right? The doctor was kind of telling me this is what you're going to do. I'm probably saying this all wrong, so please correct me, but something about a dye test with a dye.
Yeah. Yep.
I was gonna do that. That was the next step. And then I know there was obviously, which I think is easier too, testing of because you should also test the male partner as well if you can, right? I'm assuming, kind of see if there's maybe like something going on there, because I feel like they wanted my husband to do his testing as well. But they mentioned like my husband too. Like I know that was something that was mentioned for testing for him. And then, yeah, they mentioned a couple different things. And you're so right. It's all very overwhelming and everything. And then I ended up getting pregnant. So I didn't go through with that. And actually, I think maybe, I'm trying to think, I know your name was brought up too during that time. This was like 2 years ago. Yeah, yeah. At my office that I work at iHeart. Well, that's where we met. And they had mentioned you a couple of I think there might be some IVF moms too in that building. I know. I was like, wait, send me these doctors. Like, I need to get on it. But it did happen that way. But I do feel like, per usual, now that we are in a big social media age, right? Yeah. And obviously you're huge on social. So I love that not only do you share your story, but you do debunk myths. And I'm curious, 2 questions, right? I'm a little two-parter here. What do you think is one of the biggest myths that you have to debunk, or maybe, correct women on, that they come to you and they're so like, I know this is it. And you're like, honey, like it's not, or maybe, there's a gentle way that you might present certain things to them, but what's like the number one that you can think of?
I would say the number one myth up until this last 2 years was my partner doesn't need testing, me, or like not doing tandem testing, which is crazy to think, right? Like I would see the female alone and then they would bring their partner in. That I would say that was something that we really fought as a field. And now you see a like both partners. The other thing, which I hate, and it actually makes me really sad because I feel like we're doing a bad job as a field, that patients get their testing and they're like, well, there's nothing wrong, so I'm going to go back to trying. So it's that core definition of infertility. So I try to tell patients that infertility doesn't mean that something's wrong with you or we're overtly going to see something wrong with you. That the definition of infertility is 1 year of unprotected intercourse and you're not successfully pregnant. So it's not just it's testing and interventions merited at that point. So I think if we could change the narrative, just like you said, like, do your testing instead of failing before and then go try if you don't see anything wrong. And then if you fail, then come back would be so much easier to process as a patient, right? Like imagine even before you had to go through the miscarriage or had to go through something to know like, hey, these are my chances. Like patient education would be so much better. But I think that's probably the hardest thing to like debunk when I tell them like everything's normal, but hey, 1/3 of couples fall in this normal bucket and your title is unexplained, but it's still infertility. It's like mind boggling. Like, so you found nothing wrong, but there's still something wrong, right? It's just like saying it out loud sounds crazy.
I can 100% see that and relate to that because you're right. Like if you're not, quote, finding something, right? Like, oh, this is elevated or you have, PCOS, whatever it might be. And you're just, so nothing's wrong, but something's wrong. Yeah, exactly.
Yeah.
I can see it being frustrating. And what about, this could be a newer myth too, just because I feel like the rise and the popularity of like GLP-1, something that I saw a lot on the internet was, and I'm sure you've heard it too, even like in your office or social, but the old Ozempic baby, right? What are your thoughts on that? I feel like that's been a really big conversation the past couple of years.
Yeah. So, I mean, it's true, right? Ozempic babies are patients who, like a PCOS patient, have metabolic syndrome. So what metabolic syndrome does is it makes your insulin spike, which then causes your testosterone to go up, and that inhibits ovulation essentially, or you don't ovulate. So when you treat your insulin resistance, your testosterone levels go down, then you spontaneously start to resume ovulation. So those Ozempic babies and patients who don't ovulate are those PCOS patients. There's really no data for Ozempic utilization for infertility. There's some animal studies, again, that show that there may be GLP receptors on the endometrial lining. So maybe patients who have endometriosis or adenomyosis can lower their inflammation and they're high risk of miscarrying. So maybe it could help with that, but there's really no human trial. So yes, Ozempic babies were a real thing. These patients started ovulating because they started losing that insulin resistance component.
Okay. No, that's good to know because sometimes I would see that and I'm like, okay, I could see that. I mean, I'm not the doctor here by any means. And I'm like, I could see that, but you're right. Like, or like the stories and everyone's on TikTok sharing their experience. And I was always curious too about that, especially when I was trying to get pregnant. Of course, I don't know how you how you were too during the time, but it's like you just rabbit hole everything.
Yeah.
2 in the morning. You're like watching, Googling. I know. I was nuts. And I had to stop eventually. I was like, that's enough.
It would drive me crazy. Yeah.
Yeah. Oh, 100%. So I kind of want to dive into like you and your family life and obviously your business onto health. So you said a year ago, you sort of branched off and did your own thing, created, your own, I'm going to call it your own place of just Dr. Roohi. Like this is your baby. This is your 4th baby. Technically.
Baby. Yeah.
Yes. Yeah. I love it.
So I got the idea a year ago because I realized I was practicing really fragmented. I was practicing very different than my partners at this big network.
Okay.
And because this is not the standard of care, it would be always like, oh, Roohi and her patients, Roohi and the way she practices. Like it was harder, right? Like when you're trying to practice very personalized medicine, which to me, this is very personalized medicine, yet like be investigational and treating everyone as an individual and looking at what everyone needs, you get the most challenging patients. Like I do some really difficult cases. So a year ago, I became a key expert opinion leader for company who invests in fertility and women's health. And then they were like, wow, you have such a unique approach and you really need to start a company. And I was like, no, I'm fine. Like I have a very busy family life. I have a huge family. And I was like, I don't know if I want to do this. And to be very like just front talk, sometimes when you just like lose hope, because first I thought I was going to do it through science and research with that NIH. Then I thought I was going to do it in a boutique practice. Then I thought I could do it in this big network. And so I was like, well, maybe I'm just destined to do it at one patient at a time. And I kind of settled on that. I was like, let me just do it one patient at a time. Whoever seeks me out, I will be that source. And maybe I can't mass do this. Like it's not the right time. And when I became friends with this company, they're like, you really need to do this. You're missing out. And, so many people come to you and it shouldn't be that you have to have a Roohi to have hope. It should be that there's a place for patients like this. So I finally, in October, was told by somebody that I'm replaceable in my company. And I think it kind of struck a chord. Yeah.
Yeah.
And I said, yeah. And I don't think I took it well. I don't know if I was having a bad day too. And I was like, well, you know what? I quit. And they're like, okay. And I was like, okay, I quit. And like, it felt really good. So I quit my job in October and I gave my 90 days and started on To Health the day after. So we're in our infancy. We're 6 months in at best. And it's been fun. It's come with its own challenges like construction or things like I'd never had to do my own credentialing and licensing and all of that fun stuff. But yeah, it's been a journey.
That's such a beautiful, fun journey. No, I hate how that happened, but I love that you branched off and like, at the same time, like almost knew like, okay, this was the route. Cause like you said, you were, debating this way, like, what should I do? And now the pieces have fallen together. And I think this way too, you're able to help a lot more women, right?
Yeah.
Aspiring mothers, probably at a much higher and successful rate than before,
Yeah. Yeah, I can standardize protocols. I can, like you don't have to see me. And it's so sad. Like I just saw this patient from Canada. Like, I don't know how to get to you, but I really need you. And it's so sad to, like have to have said no. And now I can standardize a protocol. I can share. I could help people at scale. And that's always been my dream. Like, how do I leave an impact, right? Like, how do patients not have to go through what we had to go through? Like, how are you not ashamed to be in that position?
100%. And what about like just your everyday balance, right? So now we've got like, I'm going to call it the fourth baby, right? The business, like you said, you're doing things you've never had to do and like really think about or deal with. Plus you have 3 little ones. You have your 12-year-old and then your 2 other kids. And then you also have, like I said, a large following on social. So that takes a lot of discipline, right? A lot of posting and like coming up with content. People think it's so easy. Oh my God, it is not. Like, I literally have to like write ideas down or I won't do it or I'll forget. Yeah. So, and I hate the question of like, well, how do you balance it all, right? Because it's like no one ever asks dads that. It's always the moms. How do we balance it? How do you do it is my question, right? Because every mom one thing I love about motherhood is that every mom, they've got their way and it just works. So I'm curious for you, like how do you do that and handle it all?
Yeah. I'm going to start with saying I have a lot of help. I have a huge family.
I love that. So, I'm an advocate for help. I'm huge on that.
Right? Same. Yeah. And I feel like anyone who tells you otherwise is lying to you. Like they're secretly doing it and not sharing it, which I found a lot of moms do. And I was like, shame on you for making me feel like I'm incompetent. But most of my help comes from my parents. My parents have been a huge asset. I had my son in residency, which if anyone's ever done an OB-GYN residency, they work you to your limit. Like you're clocking in 120 hours a week. So you live at the hospital, you barely come home. So my mom raised both of my older ones, so they're 12 and 10. All of my kids call my mom, and they call me and my husband by our first name. So because she's always with them. Like they always say, like my son will say, well, mama took me home from the hospital. And everyone's like, well, doesn't that bother you? And I'm like, no, because all that shows me is they have so much love that they have so many people to turn to, right? Like who doesn't want their kids to be loved? And it's not like they don't, right?
No, I'm like, cause my daughter has both grandmas. We're 5 minutes away. That's by design. I'm like, why would I ever bother me? Like, I didn't have a
Yeah.
single grandparent growing up, no biological
Yeah.
grandparents. Why would that bother me? Sorry, I just get so heated about that.
No, same. I loved it. So, and yeah, they do it all the time. Like last night, my daughter woke up at midnight, the baby, and she said, "Can I go to mama home?" And I was like, "Of course you can go to mama home." And then she's like, "But," she calls me mommy. She goes, "But mommy, I'll come back in 7 days, okay?" And I was like, "Okay, you do that." She's 3. Like, you do that. You come back in 7 days. um, but yeah, so I have a lot of family that help support my cause and mission. And in addition to having them there for my kids, it shows me that they really believe in what I'm doing. So that's a whole nother added benefit, right? Like somebody believes that you taking time away from your family and your kids is truly a value added to our society. So I love that. And, but I'm going to leave the thought with, I'm not good at everything. Like some days you're going to be a good mom, and some days you're going to be a good CEO, and some days I'm a great doctor. And I used to be really hard on myself when I couldn't be good at everything every day.
Right.
And I think it's important to remember and that you can't be, right? Like you're going to have bad days, and apologies are okay. And saying, hey, I didn't have the best, especially when it comes to patients. Like I am the busiest fertility doctor in the country, but every single one of my patients has my cell phone number. I memorize everyone. I review everyone because I never want people to feel how I felt. Like I really felt like a number. One of my fertility doctors, literally, I'm usually not a mean person at all, but I was speaking at a conference and she came up to me and introduced herself, and I literally couldn't control it. Paulina, I was like, "I've been your patient for 4 years." And she was like, "Oh, I knew that." And I was literally like, "No, you didn't. You did not know that, but nice to meet you." So like my whole purpose is never to make somebody feel like that, but it is. It's hard. It's very hard. So I have to remind myself that I'm not going to be perfect at everything every day. And that's okay.
And that's okay. 100%
Yeah.
agree with that. Oh, I love it. No, I love your mentality. I love your mindset. I think what you're doing is important in all your roles, from, being a mother to, again, being, a fertility specialist, helping others. Like every role and every hat that you wear is what makes you you. But like also like I think that you are the best version of yourself for everybody too. And I think that does stem from like doing what you love, truly. I do think because you have, again, so much experience living it, right? And then shout out to the village, which, your parents are a big help, and that's such a blessing. I love that for you. What do you think 14-year-old Roohi would think of you today?
That's loaded. I'm an overachiever. This is gonna make me cry because 14-year-old Rui was, yeah, would be proud.
Think so too. Now I'm gonna cry. I'm such a little. I know. I gotta chill. Oh my God. I think she would be very proud too. I think she would be very proud of you. Just, I don't know. You've helped so many people. Even coming on this podcast, I hope someone is listening right now and like getting the hope that they are looking for, right? Or some clarification, some kind of answer, some sign from above, whatever that might be, Because I remember being in that position and I was like, it might have to be me, right? At 1 year mark, I was like, we just hit it. So let's get to work, and I was mentally preparing for it because I knew it would be a journey, right? And I was grateful that the option was there though, to begin that, and start that. Like, obviously, we didn't have to, and it just happened. And I got pregnant, like, I was 3 months pregnant at my wedding. That was not planned. That's the funniest part. I had a Vegas wedding. I was insane. And I know but I was so excited. I'm like, oh, we got the party bus. We have Elvis driving us. I'm going to be so drunk. It's going to be crazy wedding weekend. We had 100 people. I was pregnant. So I was like, well, we do this like crazy wedding weekend that I thought, they all had a good time. Okay. Me, I was sober, but everybody else had a good time. But it's a joke now too, because I'm just like, I'm not going to get pregnant. Like, that's crazy. And guess who got pregnant? I was 3 months pregnant. So I wasn't showing yet, but people knew obviously, but like I wasn't showing. So I still got to wear the same dress. I bought the whole thing. So it all worked out, but it's too funny. The story, I was just laughing at myself because I was kind of a clown.
It's so amazing. And that's so amazing, right? Like, I'm so glad that something came from like you even sharing with like people at your workspace. Like, I feel like that's such a burden offloaded, but also creates that sense of community that I feel like we need.
Yes. Oh yeah, 100%. Like I know like I'm like you, I'm a yapper by nature, but like, when it comes to subjects like this, I always want to make sure people know that like, A, you could be comfortable talking to me about it. And then number two, understand that like we're probably going through similar situations or similar things, especially in this motherhood journey. So yeah, no, I was glad that I was able to talk to them. And I feel like you know who I'm talking about too at work.
Yeah.
It was just cool to like bond over that because I never expected that, so.
Yeah.
It was good. It was good stuff. So I really appreciate you being here today. Where can we follow you on social? And then also, are you taking new clients or new patients if somebody wants to see you?
I am. We're taking new patients. And right now we do fertility and holistic health. And you can find us at Onto Health, or you can find me on social at Roohi Jeelani, MD. So my biggest platforms, Instagram, but I am trying to branch. I'm trying to be better. I mean, props to you for launching a podcast with a toddler. I like dabbled into it last year and I was like, oh my God, this is so much work. Yeah.
It is. But like you said, I got the village, like, watching her downstairs literally right now. We're about to get ready for nap soon. And then I send this off to my editor. He's going to see this right now. Shout out to Norson. I mean, like you said, it takes people to make this ecosystem work. So yeah, I mean, if you get your podcast going, I would tune in. Like you need to.
Oh, you would? Oh, I recorded. Well, I don't know if I'll change the name, but it was called Doctor Am I Ovulating? Because that's how I started. I'm like, do you know how when you start tracking, you're like starting, I'm like, am I actually ovulating? What does that mean?
Yes.
So I was like, that should be the name because I was told I'm not going to ovulate. And then I started thinking, am I going to ovulate? I recorded like 4 sessions and then I stopped the editing. I was like, this is a lot of work. But yes, I will let you know if I ever get back to it.
Yes. Awesome. Well, thank you for being here today. We appreciate you.
Of course. Thank you for having me.